Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Todd Martin, who is a nurse practitioner out at Family Practice Associates. Welcome.
Thank you.
All right, I mentioned gastroenterology disease, and we started out with heartburn. Let's talk a little bit about GERD and tell us what that stands for and what it is.
Yeah, so we have a lot of long words in medicine, so we try to abbreviate when we can. GERD stands for gastroesophageal reflux disease. So kind of the reflux or the backing up of the gastric contents up into the esophagus.
You have chest pain?
Chest pain, a lot of people think they're having a heart attack when they have GERD. A lot of times heart attacks present just like GERD. GERD presents just like heart attack. So you have to be real careful with your diagnosis and evaluation of the patient to make sure you get it right.
And if you're having what you think is heartburn, you want to make sure it's not a heart attack.
Exactly.
How do you treat it?
So GERD's treated several ways. There's over-the-counter medications that you can take, such as Pepcid, Tagamet. There's some prescription medications. Some of them are over-the-counter now. Prilosec. Those are called proton pump inhibitors that kind of help minimize the acid production in the stomach.
Now, acid production in the stomach, and you get reflux and heartburn, but you also have an ulcer, and it's similar?
Similar, very similar. Symptoms present very, very similar. One thing with peptic ulcer disease, you can see kind of dark stools from bleeding in the upper bowel. As it passes through, it gets darker. Pain with meals, things like that.
So you don't want to, if you see dark bowels you think might be blood, that's a red flag. You need to be looked at. That's one of the risks of ulcers.
Absolutely.
All right, another big thing that a lot of people have is what we call IBS. Tell me what that stands for and some of the symptoms of that.
So IBS is irritable bowel syndrome, and there's two predominant types of irritable bowel. There's diarrhea dominant and there's constipation dominant. And people with diarrhea dominant, they can have constipation too. So it's not just always diarrhea, it's not always constipation. It's usually a mix, but predominantly one over the other. And those are treated with different medications as well. They present abdominal pain, urgency, constipation, frequent bowel movements. You always be wary of fevers because you can develop with those things. You can develop infections in the bowel and stuff.
Well, now you mentioned infection. We'll come back maybe to irritable bowel, but sometimes if that pain goes to the right side, you have to think of something different.
You have to think about appendicitis at that point. So appendicitis presents usually feeling pretty bad, low-grade fever, sometimes high fevers. Right lower abdominal pain is kind of the classic presentation, but not always. Nausea, vomiting, pain with movement. So like when you're walking and you're getting jarred around, you'll have some discomfort with that. Those are worrisome signs that you should be evaluated.
When you say evaluated, is there a specific thing you do to diagnose appendicitis?
So appendicitis, CT scan, ultrasound, blood work, and a good hands-on physical exam.
So fever, right lower quadrant pain, see your doctor.
See your doctor.
Now, another thing is that we see pretty common is gastroenteritis, nausea and vomiting for, I guess, multiple causes.
Multiple causes. So it could be viral, it can be bacterial. Things you worry about, fever greater than 100.4, blood in your stool, certainly you should get evaluated immediately with that. Abdominal pain, usually it's kind of diffuse abdominal pain, not really in one spot.
And one of the big things that we always worry is dehydration. What are some symptoms that dehydration may be a problem?
Yeah, decreased urine output is the primary thing that I tell patients to watch for. So if you're normally urinating, 5 times a day and you've gone once in the last 24 hours, that's a worrisome sign.
So you can sometimes treat this at home if you stay hydrated, don't have a fever, and you get better?
You can. So viral gastroenteritis, a lot of times 3 or 4 days they're back to normal, but hydration is the key, and any kind of questions, and it's just not going away, you should get evaluated.
So one last thing here before we finish. Gallbladder, right upper quadrant instead of right lower quadrant.
That's correct. So gallbladder disease, right upper quadrant pain. A lot of patients complain that it radiates through to their back, usually worse after eating. spasmodic. It'll get real intense, and then it kind of eases up, and you think, oh, I'm past this, and then it gets intense again. So always be aware of that, and again, diagnosed with ultrasound or CT scan and a good physical examination by your doctor or your nurse practitioner.
There you go. We appreciate you coming in. We appreciate all the care you give to the patients, and thanks for talking to us about it. All right. We'll be right back.